Next, we are going to discuss hepatic injuries with a special focus on hepatitis. Here are your clinical objectives related to hepatitis.
Your liver is located in the right upper quadrant of your abdomen. It's a solid organ about the size of a football, and it is highly vascular. The liver is continuously filtering blood, and it holds about a pint of blood at any given time. The liver is a necessary organ because it has so many vital functions in the body. And if the liver fails, a person cannot survive. And for patients with end-stage liver disease, the only treatment is a transplant, nothing else.
The liver serves as a detoxifying agent by removing toxic substances from the blood. It also plays a role in digestion because it's going to produce bile, which is going to help break down and digest food. The liver is also a major player in metabolism because it is going to regulate and metabolize the macronutrients. The liver is a key player in the coagulation cascade because it's going to synthesize prothrombin, fibrinogen, and all your other clotting factors except for factor 3, 4, and 8. The liver also serves as a storage unit. It is going to store and release glycogen and other essential nutrients. It also plays a major role in immunity. The liver is going to support the immune system in various ways. It also plays a role in red blood cell regulation. Now, most erythropoietin is produced by the kidneys, but some is produced by the liver. The liver is going to work with the spleen to degrade old red blood cells and break it down into bilirubin and other bile pigments. And the liver is going to metabolize drugs into their inactive form so they can be excreted by the body. The liver is also responsible for metabolizing about 70% of lactate, and it is going to synthesize glucose from this lactate. And remember, lactated ringers is contraindicated in severe hepatic failure because this can cause an accumulation of lactate because in liver failure, the liver is unable to metabolize this and convert it into other substances such as glucose. Now, the liver also is going to synthesize cholesterol, which is going to be essential in the production of various hormones, such as your sex hormones, and it plays a critical role in vitamin D production. Now, the liver also breaks down ammonia, and we know that ammonia is a very potent neurotoxin. If you don't believe me, go drink a bottle of Windex and see how you feel. And what your liver does is going to break down ammonia, which is going to be produced from protein metabolism and other normal metabolic processes in the body. And your liver is going to break this down into a substance that can still be neurotoxic, but to a much lesser degree, and that is called urea. And urea is going to be eliminated through the kidneys. So that's why if you have a liver dysfunction, you can have an elevated BUN And that's why I said that BUN is not very specific to the kidneys, because various disorders and dysfunctions in the body can lead to this, such as liver impairment.
Hepatitis is inflammation of the liver cells. So when a person has hepatitis, their hepatocytes, which are the functional unit of the liver, are inflamed. And this is going to impede normal liver functioning, and this can cause damage to those liver cells, which can progress and continue and ultimately lead to liver failure. Most of the time, hepatitis is caused by a viral infection. However, there are non viral types of hepatitis as well. There are multiple types of hepatitis and there are multiple causes. Some are self limiting and are acute in nature, meaning they last less than 6 months and there's no residual effect. Or some may be chronic, and the chronic forms can lead to things such as cirrhosis, liver cancer, and ultimately end stage liver disease. Here are just some general risk factors for both viral and non viral hepatitis. And as we go into the viral hepatitis, you'll see that there are going to be more specific risk factors for each type of hepatitis. But overall, your risk factors can include alcohol abuse and drug abuse. Autoimmune disorders can lead to non viral hepatitis. Unprotected sexual activity, especially anal or between man to man. Exposure to hepatotoxic substances, which can include medications such as acetaminophen. Cholelithiasis or biliary obstruction. Cholelithiasis is just gallstones, but gallstones can become obstructive. They can get obstructive in the biliary tree, and this can cause a backflow of bile into the liver and really irritate those hepatocytes. Things such as hyperlipidemia and high fat diet can lead to things like non alcoholic fatty liver disease. As nurses, we are regularly giving medications to patients, and it is important to be aware of the potential complications of these medications that we are administering. And you would be surprised of how many potential complications some of our most common medications can have on the body. Many drugs can be hepatotoxic. Some can lead to hepatitis. And ultimately, some can lead to death from hepatitis that is going to progress to end stage liver. So it's very important to just be aware of drugs that can cause injury to the liver. And again, it's pretty surprising. Aspirin, amiodarone, many of your antibiotics such as Cipro, erythromycin, clindamycin, amoxicillin, medications such as losartan and lisinopril, NSAIDs, many of your psychiatric medications, including your antipsychotics and your SSRIs. Also, your anticonvulsants, such as valproic acid, oral contraceptives. I mean, this list here is just a small snapshot of the many, many drugs that can be hepatotoxic. So I just wanted you to be aware of it because a lot of times we're giving medications and we're just not thinking of all that they can do. Like statins can be very, very hard on the liver. So you just need to know these things and you'll learn them over time. But just be aware. For patients who have experienced acetaminophen toxicity, which is going to include taking more than 4,000 milligrams within a day or taking a large amount at one time. They're going to be at risk for that acetaminophen toxicity, which can cause hepatitis and ultimately lead to acute hepatitis and death. However, there is a medication out there, acetylcysteine, which is a respiratory medication. It's actually mucimist. And what it does is it can reverse the damage that acetaminophen does to the liver. Because what happens is acetaminophen in large amounts is going to diminish glutathione, which is a liver protective enzyme. And it protects the liver from hepatotoxic substances. And when we take those large amounts of acetaminophen, we're diminishing it. And now acetaminophen is going to be very hepatotoxic. So if we give acetylcysteine in the first 24 hours after acetaminophen toxicity, there's like a 90 something percent chance that the patient will not have any long term effects. Acute hepatitis has various symptoms, including malaise, fatigue, nausea, vomiting, anorexia. You may present with a low grade fever, jaundice, dark colored urine caused by the bilirubin, or right upper quadrant tenderness. Chronic infection is generally asymptomatic. A patient may experience malaise and fatigue, but most of the time they're going to be pretty asymptomatic until it persists on to something more severe like cirrhosis and end-stage liver. We can use various diagnostic tools to help us diagnose hepatitis. For example, in hepatitis A, B, and C, we're going to look at those specific serological markers. If a patient has the antigens for, let's say, hepatitis A, that means they have active infection. They may also be present with antibodies, which could indicate that they had a previous infection or they are immune through vaccination. We're going to look at those liver enzymes. You'll often see acute elevations in your AST and ALT. They can get up to the thousands. Alkaline phosphatase doesn't always elevate, and actually that can stay normal. We're going to look at that serum total bilirubin, which is going to be consistent with that clinical appearance of that jaundice and that dark urine. We can use things such as a CT and an ultrasound and a liver biopsy. Viral hepatitis is caused primarily by the hepatitis virus. And we have hepatitis A, B, C, D, and E, with A, B, and C being the most common in the United States. And although each of these strands are the same virus, they are going to differ in their mode of transmission, severity, and in their prevention methods. Hepatitis can also be caused by other viruses. Think about it. Hepatitis is just that inflammation of the liver, and other viruses such as the Epstein-Barr or the herpes virus can do that. Varicella is also known to do that, and the cytomegalovirus. Hepatitis D gets its own slide because hepatitis D is different. Of all the hepatitis viruses, hepatitis D is the most unique. It is known as a satellite virus, and that just means it can only infect people who are also already infected with the hepatitis B virus, or transmission may occur as a co-infection with the hepatitis B virus. It may cause acute or chronic infection, but it usually results in chronic infection, and it's transmitted the same way that hepatitis B is, through blood and bodily fluids. It's rare in the United States, and most commonly in the United States, it's going to be spread through IV drug use. And just think about it. The prognosis for having both hepatitis B and D is going to be worse than just having hepatitis B alone. And there's no specific vaccine for hepatitis D, but the vaccine for hepatitis B does offer some protection since it can only occur as a co-infection. And treatment is going to consist of supporting care or interferon. I have put hepatitis A and E together because they're the most similar. Both of them are going to be spread by the fecal oral route. So they're going to be spread by contaminated food or water, especially shellfish and undercooked pork. So it's important to cook your meat to the appropriate temperature advised by the FDA. You can also get this by coming in direct contact with infected stool or via anal sex. Both of them are going to lead to acute infection, and it's generally self-limiting, but with hepatitis E, it's going to be more severe in pregnant women, and it may become chronic in patients who are already immunocompromised. The best prevention for both of these is proper hand washing. You want to have proper food handling. You want to drink purified water when traveling. And treatment is generally going to be supportive in nature. It's going to be specific to those symptoms because the patient is usually going to have mild flu-like symptoms. The types of hepatitis you're probably most familiar with are going to be hepatitis B and hepatitis C because these are going to be more common in the US and they're going to be more likely to lead to chronic liver conditions such as cirrhosis and liver cancer. Hepatitis B is going to be spread via blood and bodily fluids. It can be passed on to the mother to the fetus, so through unprotected sex, sharing dirty needles during IV drug use, accidental needle sticks from healthcare workers. It can cause acute and chronic disease. But the good thing is there's a vaccine available. Treatment is going to be antiviral drugs. You want to do that interferon and other various antivirals and monitor the kidney function. But for the most part, it's just going to be specific symptom treatment. Hepatitis C is the most common bloodborne disease in the United States. And hepatitis C, of all of the hepatitises, this one is most likely to lead to chronic infection. And you can get it via IV drug use, accidental needle sticks, infected tattoo equipment. So don't go to that low budget tattoo place that is not legit. You can get it from accidental needle sticks. And very, very, very rarely, because it is very well conditioned now, but you could get it through contaminated blood products or transplant. But there are so many measures in place to protect patients from that. The best prevention is primary prevention. Avoid high-risk behaviors. Practice safe sex. Unfortunately, there is no vaccine available. Healthcare workers should practice safe disposal of needles. Even though there is no vaccine, there is a treatment available that can cure hepatitis C if caught early on, which is one of the benefits. Complications of acute hepatitis can be chronic hepatitis, chronic liver failure, cirrhosis, liver cancer, end-stage liver disease, death. Nursing considerations for patients with hepatitis are going to involve rest and activity management. We want to promote rest to reduce those metabolic demands of the liver. So we're going to provide the patient with opportunities to rest. We want to gradually increase activity as the patient tolerates. We want to focus on nutrition, encourage a balanced diet to support liver function. You want it to be high in carbs. And you want to ensure adequate hydration. And as nurses, we are educators. We want to provide patient education, such as avoiding alcohol and other hepatotoxic substances, educating on preventing transmission, and providing information on vaccines if applicable. Symptom management, administering antiemetics, antivirals if applicable. You want to monitor and manage that fatigue. And psychosocial support, you want to address the emotional concerns, and because it can be very depressing to have hepatitis, and you want to provide resources for coping for that social stigma surrounding alcoholism, hepatitis, and whatnot. Let's talk about some health promotion strategies for hepatitis A, B, and C. The incidence of hepatitis A is actually declining. Why? Because of vaccination. It is also important to encourage patients to wash their hands properly with soap and water, to avoid contaminated water, drink bottled water when leaving the country. Listen out for those boil advisories. Turn off your ice maker when there's a boil advisory. Avoid swimming in contaminated waters and drinking it. You also want to teach them about receiving the immunoglobulin within 14 days of exposure. Hepatitis B, just like hepatitis A, its incidence is declining. Guess why? Guess, 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 guess. You'll never get it. You'll never get it. Vaccination, such a great thing. Who would have known? And other things that we can do to promote health strategies are going to be patient education surrounding avoid sharing razors, toothbrushes, and other things, because remember, this is going to be spread by blood and body fluids. We want to have clean IV drug needles if they're going to continue to do drugs. Watch out with the tattoo shops. Don't go to them sketchy low budget places. You want to teach them about safe sex practices. And hepatitis C is of the most concern. Over 58 million people have it worldwide. And of these three, it is the most likely to lead to chronic infection, which will lead to cirrhosis, increase the risk of liver cancer, and ultimately end-stage liver disease. We want to teach these patients to be avoiding alcohol. You want to teach them again about those safe sex practices. You want to teach them about avoiding contaminated needles and focus on preventing the transmission of this since we have no vaccination for this. Thank you for listening to my presentation. And remember, watch your alcohol levels because when your CWA is higher than your patient's, you may have a drinking problem.